A warm welcome to all our viewers to our series Natural Medicine. Today we talk about TCM. I read a wonderful book where we can recognise different symptoms and indications and can use it with a tea blend that gets specially tailored for us. And I have Dieter Hölle with me. He is a real specialist in general medicine, but with a focus on TCM. And I'm very curious what he tells me about these great forms and substances in our interview today. Stay tuned. Hello, Dieter. Thank you for coming.
Hello, Karina. I'm glad to be here.
I read this book with great enthusiasm because I thought it was great to get this holistic view of the human being from the TCM point of view was used. You really showed that in the book, so you really covered topics like, I have to look a little bit more, abdominal pain, feeling of pressure, feeling of fullness, liver problems, that you really recognise the different positions that come together to combine a picture as well. And then also these tea ingredients, which are then, again, so individual. But at the very beginning, I'll just ask you, TCM itself works differently than this German academic diagnostic program, doesn't it?
That's exactly how it is. Maybe I need to say a little something to understand TCM well. Some things are difficult, some things are easy, and I try to keep it simple. TCM is an extremely personotropic medicine, so that means it's usually tailored to the individual. You can't do that with the book now. You have to try to make proven recipes that have a certain universal validity. Just imagine, the TCM is at least 4,000 years old. The first origins are from the Chinese shamans, from the healers of earlier times who only passed on their knowledge in the family. No books were written then, and they had to make do. They didn't have any machines, they couldn't examine and look at the medicines, what active ingredients are in it. They simply had to use their senses, seeing, smelling, but also tasting. But also had to get along with trying things out and had to tailor it to the patient. And not with their illnesses, because the term illness actually never existed in that sense. The Chinese always speak of disharmony. Disharmony means something is somehow out of balance, and it's somehow no longer, we would say in our language, no longer in their centre. And you try to balance the person with the drugs, to harmonise them, to return them to their centre.
You also use completely different diagnostic methods in TCM than in academic medicine. So if you were to analyse me, you would act very differently than if I came and said, whatever, I have water retention or something.
That's really interesting, because the diagnoses aren't really there. And for example, in my consulting room, a patient comes in to me and I can see that they're coming in quickly. Emphasise the step. Another walks slowly, more stealthily, more careful, has a quiet voice, and the first has a loud voice. I can tell the difference between the two types. And I have to adjust my medicine accordingly. So one needs something that gives a bit of power, a bit of drive, and the other one has to be brought down a bit, as we say in our language. And it's like that in China too, that for the diagnosis, harmonic terms are used. So the heat is out of balance, the heat is rising, the cold rises downwards. These are the terms that are used. And there are very important basic terms, for example, the qi, that would be our life energy. I think everyone knows that by now, from Chinese medicine, that the energies move and run on certain paths, on the pathway, on the meridians. And that would be one of the factors that we need in order to understand. Because here, for example, there is stagnation, that is, the energy is trapped somewhere. It's blocked by a stressful situation because the muscles are tense. The qi doesn't flow through it well, and then there's the notion of qi stagnation. It will then be resolved, and the underlying illnesses in our sense are then treated. It's a bit difficult to understand, but I'll explain a bit more later in a few other questions and situations from the recipes. Perhaps one more question from you about certain statements in the recipes. We can explain this again using a specific example.
Back to the diagnostics. Now you have the talk, this dominant or this rather calm walk. How do you proceed then? Where else do we have diagnoses?
Well, talking to the patient is important that you talk to them. I see a lot there too. The temperament, I can already see the cramping. When someone sits there so tense, I know they'll have a headache up here or have tension. They'll have arm pain. I can always say straight to their faces what complaints the patients have because of the walk, by looking at them and then by questioning them. When they tell me certain things that they're suffering from, they're often not our diagnosis in the Western sense. They simply say, I have calf cramps, I would have pain up there, I have a headache in the back. Then I ask further, where is the pain? What is the expression of the pain? Is it stinging? Is it burning? I have to incorporate all of that into my drug therapy. Are they pulling to somewhere? Are there other symptoms? Is there maybe nausea? Is there perhaps heat involved? Is there a red head? Are you feeling cold? This is all important information that I need to use.
Is it also a bit like homeopathy? There are so many different symptoms that tell you if the child has a fever, does it have a red head or not? Does it get better when sitting up?
Correct. Yeah, I'm also a homeopath and know my way around quite well. For example, belladonna, atropa belladonna, deadly nightshade, has a really red head when in a fever and protruding veins. That would be a symptom of fullness in Chinese medicine. So something is too much. And too much always means not good. Maybe not when it comes to money. But when it comes to symptoms, fullness is actually more of a disadvantage. For example, when disease-causing factors enter the body from outside, these are mostly symptoms of fullness at first, and most of the time they're not good. The body then has to compensate for this, stimulated by our medicinal mixtures.
Do you also use eyes, tongue in diagnostics? There are also different options.
Well, according to Chinese medicine, there is a facial diagnostics method that isn't used very often, but has a high level of information in the form of facial expressions, in the form of colour. The face is rather bluish, the arteries and veins are rather bluish, which you can see. Some of them are clearly pronounced. Or do they have a displaced face? Do they always have a grinning face? There are different ways of expression. A sad face and an anxious face. That's where the fear comes in. And so I just keep asking, are there fears? Just by the appearance of the patient. And questioning is not everything. We were now at touching. For example, there's a pulse diagnosis where we use a certain technique at different depths. At these 3 pulse points around here. It's a bit different. You have to have your hand like that, but just an example. The pulse is felt, namely on the surface, in the depths, but also in the middle. And there are pulse qualities. For example, slipping, which feels like little beads, slipping through the arteries. And then there is a wiry pulse, which occurs quite often when you are tense with qi stagnation. You have a feeling that a wire is running through. Tight, we call it. This is information from the pulse. It's very complex. I can't tell you about it here on the show because it is very complex. Then we have the very important tongue diagnosis. Maybe a small example. The tip of the tongue is associated with the heart. And if there's a red tongue, I know the fire of the 5 elements is too strong. The heart has too much power. In China, they say too much yang. Yang is always what is powerful. What makes power, what makes strength. And with the heart, you also want there to be a balance between this power, but also between the calm. We might call it relaxation. In China, they say balance between yang and yin, or yin and yang. And you try to balance that. Either, depending on the condition, the yang is brought down, by the drug, or the yin is strengthened depending on the situation.
Exciting. I would like to do another show with you about tongue diagnostics. A lot of questions come to my mind right now.
Yeah.
But I think that's also important, this topic.
Especially the terminology. You can understand a lot from the tongue diagnosis and also from the pulse diagnosis, which is complicated. Tongue diagnosis is relatively simple, but also from the face, from the body, from the statement of the expression, one can already guess and know a lot. With most of them, I already know when they come in. You have such and such problems.
The nice thing about your book is really that you gave us the opportunity, even if we don't have the time right now, or maybe we don't have the opportunity to carry out such a complex diagnosis for such everyday topics. I would just start with you on page 28, your Stressex.
That's the name in the book. There is a name that I made up. It's not a Chinese name. I'm now also on page 28. The Chinese name is Chai Hu Shu Gan San, which means something like Chai Hu is the medicine, the main medicine, the leading figure. Now, I have to say something. Every medicine has a ruler. They master the whole recipe. They are the boss of the recipe. They set the big direction. And then there is a general who supports the boss in their work. And then there are messengers and helpers. The helper medicines, the messenger medicines, they give a bit of direction as to where things are going in the body. So, whether the drug's intended to act on the stomach or on the lungs, depending on where you want it to go. Whether it should influence a specific meridian, specific energy pathway, or the organ at the beginning or end of the meridian.
Great.
It's actually a great story that you can work like that.
That's why it probably needs you to say, okay, the patient's here, they actually have stomach issues, but somehow also stress, and maybe I'm seeing belching right now, nausea, mood swings. That's quite a lot.
That's the symptoms. In these recipes, I have tried to choose and align the symptoms in such a way that you don't need this difficult Chinese diagnosis, that you set the direction a bit by using the indication and the symptoms, so that self-therapy is also possible. Although you always have your limits. With complex, difficult diseases, it is better to go to the TCM doctor. You can no longer do that yourself. But I try to use recipes here that are used as everyday recipes in China. The layman Chinese who have little idea go to the pharmacy and say, I need the Chai Hu Shu Gan San, and then the pharmacy makes it and they know what to do with it. I think we should come back later to the various possible uses. For now, that would be the possibility of using the so-called compactates. We'll talk about that again later. You have to buy them at the pharmacy. For example, in the Bahnhof Apotheke in Kempten, Germany.
It's well known.
There are certainly several pharmacies that have this, but I don't know the names. I just know the Bahnhof Apotheke that deals with it, and that they can also have them made. But maybe a bit more about that later. We'll get there automatically. If you look at the ingredients, you can see the Bile radix, the so-called rabbit ear. So this is a plant product and not an animal product, even though it's called rabbit ear. I wrote the recipe once, and then the patient got the answer when paying the bill for this recipe. They would not pay for any animal product. So I immediately wrote them a letter that they should better research what radix bile really is, that it's just called rabbit ear. It has a bit to do with the shape of this plant. This is also the guide here, the ruler in this recipe. And bile is a remedy that clears the heat a bit, which dissipates heat downwards, but which also moves the qi. And that's why it's suitable for all diseases where the qi stagnates, especially through stress, through tension. And if it upsets your stomach, then I also have the stomach medication, and I can also If I were to create the prescription myself, I could also simply add a drug to it. So add a plant or leave something out. But here we depend on the simplification of Chinese medicine. The first thing we have is this rabbit ear, which moves qi and can therefore treat all the diseases that follow from stress. It moves the qi, brings people down, in our language. It takes the heat out of the head, so it's also suitable for high blood pressure. Everything goes up there. We know people with high blood pressure, red heads, hot heads, and they're often hot-tempered in their own way and often have headaches. And that's why you can also find it in the diagnoses and in the indications again. And here it says stress symptoms, written by me, high blood pressure, but also sometimes when stagnation turns into depression, even with depression. However, you have to be careful. Depression is not such a harmless illness. It's more about someone having depressive episodes frequently, who disappear again. And there, you can help a little so that they are weaker or don't come at all. Then you can see that it affects the liver and that it's also reflected in the name. Chai Hu Shu, Gan is the liver, and San is the way it is prepared, in this case as a powder. And that's so casually translated in China. Recipe cooked, mix, powder in this case, that reaches the liver.
The liver really seems to be a central organ. How do I recognise that I have a problem with the liver? I mean, it doesn't say hello, it doesn't hurt, does it?
This is less about the liver per se and more about the role of the liver, which has the role of letting the qi, this life force, flow gently and harmoniously through the body. If it doesn't do that, there are problems in the body, not necessarily in the liver, but it can lead to pain. Typical, this is the Chinese liver-induced pain down at the costal arch, that one has discomfort here. These are typical signs of stagnation for the liver, and that's where it's used. But here it also says liver inflammation, cirrhosis of the liver, and here I want to say here it has a supporting, helping effect. It can't cure cirrhosis, it can't cure liver inflammation either, but it helps, and I have a lot of patients there with hepatitis, which are additionally treated with this drug and are very happy that this medicine exists.
But a liver has good regenerative powers, doesn't it? You can also, I believe, take something away from the liver and it will grow back.
Right, but of course liver inflammation is something tough, especially when it's viral liver inflammation, so hepatitis A or especially B. These are serious, terrible diseases, but they can be treated very well with this recipe. They are easier to heal. Meanwhile, there is also good conventional medicine for liver inflammation, for viral hepatitis. And it can be of great help there, and that should be added. Then, what belongs to the liver? The gallbladder. There is also an effect on it with this medicine. And typical stress syndrome in women, this chest pain as an in-between pain between the periods, but also with chest pain during the period. Mastodynia means nothing more than chest pain. Also for period pains, and also great if you have indigestion. In terms of stress disorders, if you eat too fast when you're stressed, or work on the side besides eating. If you struggle too much with food, what is healthy for me and what makes eating so heavy-headed, then it can also come to flatulence, because the digestive organs in the Chinese sense also need your mindfulness, your attention. And that's why business lunches would be a no-go, for example. Don't eat in between meals, no business lunches. And the liver, it's said, of course, also loves rest. There are also other organs that need rest. That would be additional things that should also be considered when taking the drug.
With TCM, the organs are also connected to emotions.
Yeah, very strongly. We all connect the liver to anger. The anger is such an expression of the liver.
Does someone who has liver problems then have an issue that they don't express the anger that they carry inside themselves and keep it inside? Because that always makes me think a bit. Is that someone is seething with rage?
Seething with rage. The mosquito on the wall annoys them. That would be such a person. Many years ago, there was a cigarette advertising with this. If you can't remember, better reach for an HB. A little man hits the roof because something annoys him. He goes through the roof. And the advertising says, rather reach for HB, then you relax and calm, so to speak, or that's suggested.
Well, at some point, they go through the roof.
Exactly. They often suppress it for a very long time, and then it blurts out about a little thing. But it also means people who have such a basic structure, who always get angry easily, who are easily annoyed, maybe because they take things too personally, but they just explode easily.
And about the bile, we have the saying to spit poison.
That already occurred in Egyptian medicine. It's in Greek mythology. It occurs in Greek medicine. There one speaks of the black bile that is particularly angry. And we say the bile overflows. He is really angry. And that's where the remedy can take away the anger. Anger belongs to the liver. And if someone keeps withdrawing their anger, that would be another one. The third person who lives completely differently, they are always calm. They listen to everything, but slowly boil inside. At some point it breaks out or they become depressed. And that's why the depression is also in here. This cause of the depression, this suppressed anger, this is also known in China, just like here, and it has to be treated.
If I have such a tea mixture made for me now, can it then also be that I then treat these indications such as high blood pressure and liver inflammation, but am I being led to my topics on a mental level?
Being led to is a good word for it, because then someone might suddenly start dealing with their anger. That they learn to look at themselves. Oh dear, now I'm about to burst again, I have to do something. And realizing that I'm about to be angry, or that I was just angry, is a healing process. It's also used in psychology.
How do you deal with it in TCM? Do you then let out the anger and then yell into your pillow? Or box against some backpack?
Good question.
Or am I just dealing with it in a purely psychological way? Do you know how TCM deals with this?
Of course, you try to give advice on how someone should behave. Anger ultimately arises in social life. And there's also the medicine for it. This really helps keep the anger from coming. And yet, the process of regulating anger, the emotion anger, is promoted, and that is very beautiful. The harmonious flow of energy in the body also releases regulatory powers.
So can I take that as a bit of personal development?
Yeah.
If I look at it holistically, then I can really see, okay, what kind of symptoms do I have? Stomach pain, we have a bitter taste in the mouth, or belching, nausea, mood swings. And then really say, okay, I'll allow myself to get into this process during this mixture period. You can see here now 8 days to see what's coming up there.
TCM is, of course, always a bit of psychotherapy.
So beautiful. I think that's great.
For example, in ancient China, in the clinics, there was no separation between academic medicine and psychiatry. They've all been treated in the clinic with a few exceptions. It's interesting that they're being treated on the normal ward with these drugs. And especially anger would be such a factor. Maybe what's also interesting for the stagnation, which is often the reason for the anger, that would be those citrus fruits, citri or anti-fructus. That would also be the citrus fruit, then the skin of the fruit, and then we have the Cyperus zumula, that would be the cypress grass. Those are all things that have a positive effect on the qi flow. They get the qi flowing, moving, and often take away the reason for the anger. And then at the end, perhaps just quickly, Glycyrrhizae radix is nothing but, we know it here as Glycyrrhizae is, how best to put it? I'll come back to that later, because Glycyrrhizae is the harmonizer. There is always a herb that mediates between the plants, and that would be Glycyrrhizae.
Okay.
that mediates between the other substances.
So that the tea mixture itself is harmonious, in the flow, that all partners can communicate well with each other.
Exactly.
Okay.
Glyceritze is perhaps worth mentioning in the context of other disorders. Glyceritze also has a detoxifying function in the body, a harmonizing, a detoxifying function.
Great. Dear Dieter, super exciting. And I would love to do more interviews with you and go into your recipes so that we can simply take a holistic view.
It comes from recipe to recipe.
Yes, wonderful. Thank you for your time. Now, if the viewers want to get into the topic and say, I really want to know more, I need such a recipe helper, where is there the opportunity to get information or to get a good mix?
Well, you can hardly work that out yourself. If you do want to know more, you can go to lectures given by the relevant doctors. Lectures, but also courses are also available for lay people, also in the field of naturopathy. The book is written for naturopaths. It's written for doctors who are new to TCM, and just for lay people to have a bit of support. But often they will need a doctor for that. Not everything is possible without a doctor. Some recipes are too difficult, and it's good if you have a little more knowledge about them. The book gives a little basic idea, but if you want to know more, you have to go to TCM doctors and ask who is doing the courses in your vicinity, for example.
And the book is available in bookstores?
The book is available in bookstores. You can order it. There is an ISBN number on it. I just want to show you that. It always looks like this, the ISB number. You can order it with this, or in Switzerland, through your own bookseller. In Germany, for example, you can order and view it at quantisana.ch.
Perfect.
Quantisana.ch, you can order it there. And otherwise via every bookstore. They then contact Quantisana and order it. Every book is always available as long as it has a number.
Yes, perfect. Thank you very much, Dieter, for being here. And see you soon.
You're welcome. See you soon. Thank you for listening, watching. Thanks.
Thanks.
Thanks, you too.
Dear viewers, I hope you were able to dive into TCM a bit, and it was wonderful to see again how many possibilities we have to get on the path of healing. Holistically, of course, also in this case. As always, you can find more interesting interviews at QS24.tv, and I wish you a wonderful time. Thanks for watching and see you soon. Bye.